Good morning, class. Hope you are all doing good. Please, we will be starting our topic today on malaria. At the end of the lecture, students should be able to define the term malaria, understand the causes, signs, symptoms, diagnosis, treatments, prevention and complications of malaria, and know the life cycle and its global impacts. In the first place, we will define malaria. What is malaria? Malaria is a life-threatening disease caused by a parasite transmitted through the bite of female Anopheles mosquitoes. According to the WHO, there were 228 million reported in 2019, resulting in 405,000 deaths worldwide. Causes of malaria. Malaria is caused by 5 species of Plasmodium parasites. That includes Plasmodium falciparum, which is the virus, virulent and deadly. Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, Plasmodium knowlesi primarily affects macaques but can affect humans. So, the causes of malaria species, as I said, has been classified into 5, and these are the above mentioned. What are the cycles of malaria parasites? Before somebody can be diagnosed of having malaria, or if a person is infected by malaria, there will be a cycle throughout the body, throughout the bloodstream, that you can identify as a physical examination for you to know, and based on the diagnosis that the patient is being suffered from malaria. So the cycles are as follows. Life cycle of malaria parasites. The life cycle of malaria parasite includes several stages. We have the sporocyte stage. The parasite is transmitted to human through the bites of an infected mosquito. Liver stage. The parasite multiplies in the liver cells. The blood stage. The parasites infect red blood cells and multiply, causing symptoms. Transmission stage. The parasite transmits back to the mosquitoes through the bites of an infected person. So these are the stages involved in a cycle of malaria parasites. What will be the signs and symptoms when one is being affected by malaria? There are common signs and symptoms of malaria, which includes fever. As we all know, if someone is infected by malaria, a person begins to spike with high temperature. We have chills, we have flu-like symptoms like the headache, muscles and joint pains, fatigue. We have nausea and vomiting, diarrhea. All these signs and symptoms indicates that a person is being infected by malaria. When it comes to the diagnosis, when a patient walks into your facility and complains of all these signs and symptoms, you being a health worker, the physical examination can determine. A patient may be feverish, may be having chills, may be having nausea and vomiting, or even diarrhea as discussed earlier. So the diagnosis, for the medical diagnosis that you can know and based on to diagnose a patient with malaria is the physical examination, 1, the medical history, and as the laboratory test, which is the blood smells rapid diagnostic test, which we normally call the RDT. Treatment. As we all know, after every diagnosis, we need to treat. So this depends on the severity of the disease and the species of Plasmodium. Common treatments includes artesunate-based combination therapies, which we call the ACTS. We have the chloroquines and the quinines. Prevention. After treating the patients, we need to prevent. you need to prevent for further complications. Then the preventions here. Prevention measures include using of insecticide-treated bed nets, which is the ITNS. As we know, normally our pregnant women comes to our facilities. We educate them to sleep under treated mosquito nets, and our patients also we educate them to sleep under treated mosquito nets. But in our Africa here, when you are giving the mosquito nets, people are used to cover their background gardens, which serve as a protection for their background gardens in their homes, and it shouldn't be so. Therefore, we are advised and educating each and everyone that when you go to your facility and you have been diagnosed of malaria, and we've been issued to use the treated bed nets, please go accordingly as described to prevent further complications. Also, wearing protective clothing. When people prefer coming outside, especially vendors who work in the night, sit in the night throughout, and also individuals who keep long at night in the night outside, we should all protect ourselves. Even our night wears, night gowns should be protected. We should all protect ourselves by wearing long sleeves, shirts, and long panties, so that whenever an infected mosquito gets contact into our body, they can never bite it. Also, applying insect repellents, especially students, when they come to evening studies, you need to apply repellents to send away all mosquitoes for prevention of malaria. Also, eliminating mosquito breeding sites, our standing waters, our stagnant waters around our environment. We weed our bushy areas. Stagnant water should be swept away so that mosquitoes cannot breed on it to cause malaria. What are the complications of malaria? If left untreated, malaria can lead to severe complications, including cerebral malaria, which is the cause of infection of the brain. When you get cerebral malaria, your education level will fall. There will not be a concentration in learning, and the brain will deteriorate. Therefore, we need to treat it earlier, prevent it as earlier as possible, so that we will not get into such complications. Organ failure, which is our kidneys and our livers. It also leads to severe malaria. Yes, when mosquito bites you, when you get malaria, it drains our blood. So when left untreated, it can lead to severe anemia. Respiratory distress. Yes, respiratory distress is also one of the common complications in malaria. Therefore, we should take note and prevent it earlier before any further complications. How malaria affects the global impacts. Malaria disproportionately affects vulnerable populations, including children under 5 years old, pregnant women, people living in poverty. Yes, children under 5 years old, pregnant women especially. That's why in the course of your pregnancy, when you go to the ANC, you are given anti-malaria drugs to prevent you to get malaria, which can affect the mother and also affect the baby. So prevention, it's just, if not treated, impacts the global, which brings poverty to the nation and also crisis to the community. Therefore, we need to take adhere of these measures so that we cannot fall into it. People living in poverty, yes, our surroundings, especially when you go to the rural areas, some surroundings of our people, the way they disinfect the environment, how we throw away our bins. It all forms and creates diseases in our community. And such diseases include malaria. So people living in poverty, we should just adhere to it to improve their way of sanitation. Malaria also has significant economic impact on communities and the countries. Yes, it has economic significant impact, especially when you go to our communities, our hospitals. If people are being affected by malaria, the government provides anti-malaria drugs, which in some way it affects the financial background of the nation and the community. So we should take notes of all this to prevent malaria in our communities and countries. Current research. Researchers are working to develop effective vaccines, which are the RTS, SINE vaccines, new diagnosis tools, including our RDTs, our blood smears, laboratory investigations. There are also research going on to improve new diagnostic tools and to improve our treatment. Yes, the way we treat malaria. People just feel the signs and symptoms in their homes, then they begin to treat malaria by themselves by not going to any facility for proper management. So, current research is proving on it to improve on how far education can go for our people, for the community, for the country to improve such conditions. Also, mosquito control strategies. Yes, mosquito control strategies. It involves in the individuals by keeping our environment clean, by sweeping away all stagnant waters, by weeding our bushy areas to prevent the breeds of mosquito. Doing this, malaria can be minimized in the community and also in the country. In conclusion, malaria is a significant public health threat, particularly in tropical regions. Continual research, prevention, and treatment efforts are crucial to controlling and eliminating malaria. With our help, when we all involved in this, I think malaria will be eliminated in our countries and communities. Thank you very much, students. As I bring my lecture to an end, if I may ask, is there any question, contribution that someone can bring? If no questions, then I bring a curtains close to our lecture today on malaria. Thank you.